tell Jack about the dowry.
Welcome to the Progress Texas Happy Hour.
Welcome back to the Progress Texas Happy Hour. I'm Progress Texas Advocacy and Development Coordinator Tatum Owens. Progress Texas amplifies progressive values, leaders, and actions, inextricably tied to the progress made by LGBTQIA+ Texans. Queer Texans are the backbone of the progressive movement, and we're moving the needle forward this year together. Now is the time to reverse the scapegoating, stigmatization, and censorship increasingly cemented in public policy that bans drag, rainbow sidewalks, and us, and we do that by investing in pro-democracy, pro-justice, progressive storytelling, and so much more delivered by Texans for Texans. A little bit about us. Through our no paywall podcast and digital media, we reach millions of Texans monthly, and that's made possible by folks like you who invest in independent progressive media. And that brings us to this episode. So happy Pride Month, listeners. You have followed our coverage of LGBTQ+IA, providing specialized content for queer Texans, as well as a range of intersecting progressive issues, which has included episodes, blogs, social media posts, email blasts, etc., relating to public education with anti-DEI and book ban attacks, elections calling out dog whistles and homophobic and transphobic rhetoric, Texas legislative public policy updates following a range of bills impacting queer Texans from the drag ban onward, and so much more. On top of that, we, of course, amplify progressive and LGBTQ plus leadership from Congresswoman Julie Johnson to State Rep Fenton Jones to Mayor Gina Ortiz-Jones. We believe that from statewide to local leadership, and including nonprofit allied groups, LGBTQIA plus voices need to be on our mics and inextricably tied to progress here in Texas. Today is no exception as we join the Texas Pride Community Foundation, or TPCF, the leading statewide LGBTQ+ community foundation since 2015, to discuss what Pride means to Texas. Please welcome to the show Robert Salcido Jr., the TPCF's Chief Community Impact Officer.
Thank you for having me.
Glad to have you, Robert. And let's just start off with that question. What is the Texas Pride Community Foundation, your mission, areas of work?
So Texas Pride Community Foundation, previously known as Texas Pride Impact Funds, conversation started in 2013, and we were incorporated in 2015, and issued our first grant in 2017. But ultimately, as a leading statewide LGBT plus community foundation, we really just leverage a robust network of donors and organizations to inspire giving in support of dynamic and diverse LGBT communities across Texas. We fund the gamut of organizations that do various things, from the arts to healthcare to mental health care access, community centers, you name it, as long as they're providing services and support for our LGBT plus community here in Texas. Those are the organizations that we want to help. And ultimately, our vision is to secure equitable opportunities so that these communities can thrive. And that includes all LGBT folks across Texas for generations to come.
That is so wonderful to hear. Thank you for sharing just a little bit about where you're joining us from. And of course, the TPCF also conducted the first ever statewide LGBTQ plus community needs assessment for the state of Texas in 2017, which I'm sure there are endless things to add to LGBTQ plus community needs in this point in time. Wow,
Absolutely.
Almost 10 years ago. That's wild. Then you mentioned community centers. I'd love if you could share a little bit about what a community center does and how LGBTQ plus folks in Texas fit in.
LGBT community centers across the state offer different services and programs depending upon where they're located. We have some of the larger centers located in Houston with the Montrose Center or Resource Center Dallas, who have really big budgets and opportunities for them to help the communities that they serve. But then when we talk about organizations where we really focus and prioritize are going to be our smaller community centers, who are oftentimes volunteer-led or operating with limited staff and under-resourced, really, if we talk about it. And when we think about what are the services they offer, well, in these small communities, especially rural communities, border towns, and small communities across Texas, they tend to be everything for everyone. And so those are usually the first places that people call, whether they're coming out for the first time. They need to get resources for mental health services, help with utilities or rent, or, I mean, again, the services they offer are limitless, and oftentimes they don't have the resources that they need in order to help the community that they wish to serve. And so, when we think about, community centers in general, I always go back to they are everything to everyone. And the unfortunate thing is they're often under-resourced and having to work with shoestring budgets, and really just trying to help the community the best way that they can with what they have available to them. And so it's important that they have that visibility and that presence in these smaller communities. So they're the backbone of the community.
Especially, you mentioned rural Texans and how they might benefit from community centers, and I could not agree more. I know that when we were talking with some other folks from the Texas Pride Community Foundation, when our Progress Texas team was, they mentioned I think it's called the Glass House Tyler, or the Glass something Tyler. But regardless, I know that there's some great advocates over there, including, of course, Karen Wilkerson, providing space for, as we know, rural Texans face extreme disproportionate access to healthcare because rural hospitals across Texas have shuttered. Also, another discussion in terms of funding and the importance of making sure that people have just access to getting their healthcare. And so, as we talk a little bit about the different people who might benefit from a community center and also just extra funding towards community resources, could you talk a little bit about the people that your work is targeted towards, the beneficiaries of work at TPCF?
Yeah, so I mean, when we think about, again, the communities that we wish to serve and that we want to make or we're looking for where the greatest impact can occur.
Mhm.
Oftentimes, smaller organizations, again, grassroots organizations, don't have access to the same resources that larger entities have, and so those are some of the areas where we look in terms of how can we best utilize the funding that we have available to
Mhm.
make these communities thrive. And so when we think about that, we have what we call our focus communities and populations. Obviously, LGBTQ being the larger umbrella of that. But then when we break it down into other areas, we look at, where are they geographically located? How resourced are they, not only in terms of funding, but in other programs and services that they have, access to. So looking at rural, underserved areas, border communities, towns and small cities, and ultimately under-resourced areas and neighborhoods within urban centers as well. So we kind of look at, the full scope of where they're located. And then, of course, we also take race and ethnicity into consideration, knowing that communities of color are disproportionately under-resourced as well. So Black and African American communities, our Native and Indigenous communities, of course, Texas, our Hispanic and Latino and Latinx communities, and then also our Asian and Pacific Islander communities. We're looking at, again, people of color and how we can best utilize and serve them. And then also looking at like our youth and our elder adults, like what services and what programs are needed for them, and how can we impact that. And then kind of the last area that we look at in terms of is the people that they serve themselves. So looking at people that are identified as transgender or gender expansive, people living with disabilities, people living with HIV or AIDS, and then also looking at like their situations, like particularly for like homeless youth or undocumented folks or refugees. Again, looking at those that are facing the greatest hardships. Those are the priority areas that we look at in terms of how they closely align with who we are. And then in terms of like organizations themselves, like organizations that have multi-million dollar budgets versus organizations that are on smaller budgets. Oftentimes with us, our organizations are usually between the range of 500,000 or less on an annual budget. Kind of that sweet spot is about 250,000. But we have organizations that run on $10,000, $12,000 a year.
Wow.
So
Yep.
that's one of the unique things about Texas Pride is that we are uniquely positioned to help a wide range of organizations, regardless of their size, and throughout the entire state.
I love to hear that. And I'll just name, was looking through the Texas Pride Community Foundation's website ahead of this call, and I saw some really great stats, including, of course, nearly 59,000 community members were reached across Texas as a recent impact statistic there. And out of that, 44% were identified as African American or Black, and then 30% identified as Latinx as well. So it's great to see that not only are you trying to make sure that these people are being reached, but in addition to that, that it's successful, right? That's the important.
Right.
What is the work for if it's not actually having an impact? Yeah. And speaking of, so you, Robert, specifically, I've heard, have founded an exciting initiative at the Community Foundation called Texas Health Impact Cohort. Would you tell us a little bit about the goals of that cohort?
Yeah, absolutely. So when I came onto the foundation in 2022, that was one of my primary charges was to build out the Texas Health Impact Cohort that is funded by ViV Healthcare. And so essentially what the program is that we identified through applications of individual organizations throughout the state that are working in the HIV space. And so we're amplifying the work that they're doing. Again, focusing on smaller nonprofits that are under-resourced, but doing the work. And so the initiative itself was created, again, to support those grassroots organizations that are leading innovative work already. And so some of the areas that we focus on in regards to HIV care, looking beyond medicine, we're looking at things like linkage and engagement to care, advocacy for people living with HIV, and even those that are vulnerable to it. We also look at things like, breaking down the stigma of folks that are living with it, or even the stigma of being able to have access to testing or wanting to go get tested. And then in addition to kind of these services that are offered by these organizations, the work that we're doing is intentionally prioritizing populations that are disproportionately impacted by HIV. Speaking of particularly like Black and Latinx, transgender individuals, Black and Latinx men who have sex with men. And then, of course, it expands from there. It's been a great program. We're actually in our second phase. It's a 3-year cohort, so we're in our second 3-year cohort right now. And the thing with the cohort that most amazes me, or it really excites me, is it's a multi-year investment. And not only we're investing in the work that they're doing, but we're investing in their leadership, collaborative opportunities, capacity building, and really ultimately looking for community-driven solutions, to help with this epidemic and to help with the work that is being done around HIV. And it's not just a funding project, and it's really just helping organizations build like a more sustainable impact that's going to last beyond our grant cycle. And so it's really an amazing program. We've kind of, like I said, navigated through our first 3-year cohort. We just started our second 3-year cohort earlier this year. We have 12 amazing organizations. 6 of them are returning from the first cohort. 6 are brand new. And so we're really just, trying to see how we can position ourselves to, again, have them do the work that is going to allow their communities to thrive.
As you say that, something that as a nonprofit media organization that comes to mind is the importance of just making sure there's funding to do the work that so many of our advocacy organizations across the state of Texas need to do. And I'll note that across the board, across the country, nonprofits particularly have been suffering because of a loss of grant funding. And so I wonder, has this impacted the work of some of your partners?
And these are conversations that we have often within our team, is like,
Yeah.
how are our grantees impacted? How are organizations impacted across the state? And so we've obviously seen some funding cuts from a federal level that trickle down to a state level as well, and then trickles
Right.
even further down into a county level. Those are all being impacted. But in addition to loss of funding because of administrative changes, we also see that organizations are also losing funding through corporate sponsorships and corporate donations.
Right.
We have some of our organizations reporting that they have a loss in the number of donors that they have, whether they be one-time donors or sustaining donors that either have to drop the amount that they're donating on a monthly basis or stop altogether because of our economy.
Right.
So there's a lot of different factors that work into, why an organization relies on funding from grant makers such as Texas Pride. And that just kind of reiterates why grant making is important and why it matters.
The type of grant making that y'all are doing is it's more innovative. You have traditional grant making where it was like totally restricted funding, and you have to like meet their criteria. Y'all are trying to meet the needs of your grassroots organizations, and that is so critical to why, I mean, as you have said, why that creates sustainable progress for these organizations, advancing progress for LGBTQ plus individuals across Texas.
Yeah, definitely. And I think that's one of the things with our grant making. One of the tenets of how we operate is around trust-based philanthropy. Basically, what we do is we offer unrestricted funding for general operations, capacity building. Ultimately, the organizations can choose what best needs that they have to spend the money. We have to allow the organizations the trust that to have that they know what's best for them. They work at they're on the ground day in and day out, and they know where the funds need to be utilized to continue the work that they're doing. And again, going back to what I was saying earlier, that's one of the things that makes Texas Pride Community Foundation unique is because we invest in these organizations of all sizes, from all major metro areas, rural communities, the border regions. And so again, looking at like their limited staff and resources, while they're addressing some of the state's most pressing challenges.
Yes.
HIV prevention and care is just one of them. We have mental health, housing instabilities, the support that our LGBTQ youth need, and then of course our trans communities who are under constant attack for many years now, and then just general community building and belonging. Since Texas Pride Community Foundation launched and provided our first grant to the Montrose Center, and it was for Hurricane Harvey back in 2017. So it was an emergency grant that we provided. But since then, we've provided over $2.5 million to over 130 organizations that are doing the work every day for the communities that they serve. And that to me is why grant making is important. It's why it matters, because without it, some of these organizations would not exist.
Exactly. And actually, so pointing to some of the work, before we move into the larger context impacting the circumstances for so many of these organizations, I'd like if we could take a second to address one of your points from earlier, which is the stigmatization of HIV and AIDS. Would you talk a little bit about how, there have been decades of progress for both the LGBTQ plus community and HIV and AIDS care and prevention, and yet there are still so many struggles, as we have seen here in Texas, for people in the Venn diagram of both of these communities, first of which being the stigmatization of HIV and AIDS. So if you could share just some common myths and maybe the realities that you've seen in this work.
Yeah, I mean, I think when we talk about stigma of HIV, and that has something that has perpetuated over since the 80s, since it was
Right.
first it came onto the scene, if you will. And so, and I'll speak from like a personal standpoint. My father passed away in 1996 from complications to AIDS. And so even thinking about as I was a youth and the stigma that was attached to that of like uncleanliness and you just the words and the language that we use around it can be very stigmatizing. I I recall and not to get too personal, but like when I was coming out at a young age, it wasn't about like family rejection or family acceptance that I was in the closet for. It was
Mhm.
because of my father's experience. I just assumed because I was a gay man, or a gay young person at that time, that I automatically was going to die of AIDS. Again,
Mm,
that is how the stigma is attached to it. And
yeah.
so thinking about it now, even in 2026, the stigma that's attached to like even walking into a clinic to get tested or asking your primary care physician to test you, there's
Mhm.
still some stigma attached to it. And then, we think about, how people living with HIV are discriminated against, and
Mhm.
whether it's in housing or in employment, so all these things kind of correlate with one another. And that's part of the cohort that we launched was how do we work against these things? How do we change the narrative to know that people living with HIV are not any different than anybody else. They just have another health concern that, as if you had diabetes or
Yes,
anything else, and not to downplay HIV, but
of
that's
course.
kind of where we are because of medical advancements. But when we think about organizations that are working in this space that we particularly fund as well, connecting people to HIV testing or expanding their access to PrEP and prevention services, providing peer support. That is a big one of like just somebody to talk to, somebody to have to lean on, especially somebody that's newly diagnosed, to be able to have somebody to have conversations with and kind of go on this journey with, if you will. Things like addressing transportation and housing barriers, getting to and from your doctor's appointments and being able to get your medications. And then, of course, like I said, ultimately, the fighting the stigma falls into all of these categories.
Right.
And so a lot of these organizations that we fund, whether they're specifically an HIV related organization or a community center, these are oftentimes the organizations that people turn to when they need something, to begin with. And
Yeah.
so, that's really why, when we look at it, it's why it's important that we're investing in community organizations, in the most effective ways that we can, because all these things that these organizations are helping with, are helping improve health outcomes. They're helping improve quality of life, and ultimately, they're providing that space for people to thrive. And again, that's all we're after.
I love that. And especially the term thrive, like not just survive amid the circumstances that we've been dealt, which I'll get into in just a moment, but thrive and have a community of support, not just
Yeah.
micro grants, but like mentorship, networking, breaking the stigma, so all the different aspects of what it means to just show up and ask for help. Thank you for that. So, as I pointed to, let's talk about the large as I pointed to, let's talk about the larger context for LGBTQ plus rights and advancement in Texas. I understand that you used to work with Equality Texas. Of course, that's a legal entity that protects queer Texan rights and so much more. And I imagine with that, you stay versed in policies from the Texas legislature and locally across the state impacting our community. I'd like to ask you, what can you say about the targeted attacks on queer Texans, especially our transgender peers, from bans on rainbow sidewalks and drag to our AG's bulldog attempts to target trans families and gender affirming care? Where are we left right now?
That's a loaded question, Tatum.
Yes.
Absolutely, yeah, you're correct. I used to work with Equality Texas for a number of years, working directly with, not only educating our communities about the issues and the policies that were being proposed, but also, during legislative sessions, and all that goes with that. But the truth of it is when I started in the movement, it was before marriage equality. And so that was kind of the big fight at that point. And of course, as marriage equality became the rule of the land, then they started shifting into other communities.
Right.
As I mentioned earlier, our trans and gender expansive community is under direct attack. Not only trans adults, but trans youth as well. And the issues of privacy between a family and medical providers. The state and up to federal are wanting to put their hands into everybody else's business, and when ultimately it's a decision that should be left up to the families. We saw when the transgender bathroom bills came along. Trans folks in sports, youth receiving affirming care. The list just keeps going on and on, and it's like what can we find next, and how can we target a community that's already vulnerable to begin with,
Right.
and along with the policies, of course, brings along the fear mongering and the absolutely ridiculously false narratives about trans folks. We all know that they're loving folks like anybody else. I mean, they're our neighbors. We go to church with them. They work with us, but they paint such an ugly, disturbing narrative of them. So it's even beyond the political realm. It's in public eye as well.
Thank you for providing that kind of from a firsthand account of being able to acknowledge what these policies and what politicians driving certain narratives leads to, and why, again, we come back to community centers are so critical in the midst of all this chaos, truly, that has been perpetrated by a culture war targeting queer and especially transgender Texans. And not just Texans, but as we're joining as Progress Texas today. So you pointed to the federal influence. And what I'll say about that is that on June 10th, so that's this week as we're recording, Lambda Legal filed a lawsuit against the Trump administration. I found out about this because I'm subscribed to their newsletter. So they shared the update that the Trump administration was challenging new federal guidelines that restrict the use of Ryan White HIV/AIDS program funds. So those funds are dedicated towards supporting low-income transgender people living with HIV. Under the new guidelines from the U.S. Department of Health and Human Services, people you would hope would be oriented towards addressing public health concerns and healthcare access overall, Ryan White cannot be used for gender-affirming medical care at this point, and it denies low-income transgender people living with HIV the comprehensive health care the program was literally created to provide. We, and all of our listeners, of course, believe no one living with HIV should be denied care because of who they are, and they should have equal access to health care. And so from you, I would like to hear, as a representative of a community foundation that believes in the importance of dedicated funding towards HIV and AIDS care and LGBTQ plus oriented healthcare. What are your thoughts on this matter? And of course, this is not the first federal funding that's been pulled in the name of anti-DEI measures.
Yeah, I like you. I subscribe to Lambda Legal's newsletter, and that's how I learned of it as well. And so, I mean, ultimately, they're restricting access to comprehensive health care that is much needed by trans folks, especially those living with HIV. It's as Lambda's announcement said, it's undermining the program's entire purpose,
Right.
why or how it was built and why it was built. It's I want to say disheartening, but to be quite honest, it's makes me angry
Beyond.
that the Trump administration is attempting to rewrite like all these policies and programs that honestly are working.
Yes. It's served more than 500,000 low-income individuals nationwide at this point. Yes, absolutely. Successful program.
Yeah, no, and you're absolutely right. A successful program, and it's all because they're trying to exclude a particular or a certain community. It's not done for any other reason. It's not done for any of the lame excuses that the administration is offering. It is specifically done to exclude trans folks from accessing services, and again, to be able to live a quality of life with healthcare and with what they need and what they have come to expect or receive from the Ryan White program. Like many things that the administration is doing, and many things that whether it's on a state level or federal level, it has to end up in the courts. And more times than not, it's found that it's either unconstitutional or other reasons as to why it's rejected. And the unfortunate thing is, even with the findings, if it is found, unconstitutional and whatnot, is that they still will try to find a way to get that exclusionary program pushed through. And it's just even more of a reason why funding from community foundations like ours and other granting programs are necessary, because without it, again, programs will shutter, patients won't get the care that they need. It's demoralizing, and again, adds further to the stigma of a community that is already stigmatized as it is.
Absolutely. And actually, as we finish out, that puts us on one of our final notes. Would you share further why it matters that people put their money where their mouth is? Why should people dedicate funding to community foundations to advancing LGBTQ plus progress?
Amongst many of the things that we discussed today, and fortunately, unfortunately, most of the time we focus on the challenges,
Right.
but we also need to really look at the story of resilience and progress, and how funding these organizations and these programs can really again have people that are thriving and live long, healthy lives, when they have access to care, when they have access to resources and programs that are available to them. That's why philanthropy and community organizations remain so critical. They help bridge the gap between medical advances and real world access. If we kind of look at it from that. But when we fund and when we are able to direct our dollars to organizations that are doing the work on the ground, we have to look at success not only measured in dollars granted, but also looking at success in, like I said, somebody getting connected to HIV care for the first time, or a young person finding a supportive community, a transgender Texan accessing affirming healthcare. Thinking from like an organizational standpoint of a local organization gaining the resources needed to expand its reach and to expand what they're able to offer their communities. And that really boils down to communities building power to advocate for themselves. When I look at it from a grant making standpoint, every grant is ultimately about improving lives. It's about allowing folks to thrive. And that's what we look at, as we're in, Pride Month. Pride Month reminds me of progress that has always been powered by community. It's yes, the parades and the festivals. That's important because visibility is important. But Pride to me has always been rooted in community. And so, here at the foundation, we believe philanthropy is most powerful when it strengthens the people already doing the work. And so. We all know that Pride just isn't a celebration, and it's a commitment to each other. And it's a commitment not just for the month of June, but it's a commitment that is going to last all year long and for years to come, and again, for generations to come.
Yeah, for generations to come, as y'all say. Thank you so much, Robert, for sharing. I'll share a couple of final notes. Super excited to point our listeners to, of course, in the show notes, the Texas Pride Community Foundation's website. Specifically, do go check out that Texas Health Impact Cohort if you would like to dedicate any funding towards really great initiatives here in Texas and with this group in specific. Robert, would you share any other initiatives that our listeners should get involved with, or how they can support your foundation?
Yeah, absolutely. So, for folks that are interested in donating and contributing to the cause, certainly on that, there are many ways for them to do that, from one-time donations to monthly sustaining donors, to looking at their estate planning and what kind of legacy they want to leave. I encourage folks to look at our website to do that. I'm not sure exactly when this will air, but we are having an event on June 23rd that is going to have conversation. It's a panel discussion with leaders from across the state and on a national level, having a conversation about Texas, the Texas landscape as we think about it from like a political standpoint, but also from a philanthropic standpoint as well, like how those are married together and the challenges that we're seeing and how we overcome it, move forward as a community. But certainly stay engaged on our social medias, and we'd love to connect with folks that want to get involved.
Okay, I'd love to hear it. Thank you so much for sharing. And final notes from Tatum here at Progress Texas. I'll just leave us with the note that progress takes resources. I think that trust-based philanthropy is absolutely an outlet that I would point our listeners to look into if you've not already found out about that. And we have a great example of that here today. And beyond that, something we say here at Progress Texas is when lies are well funded by bigoted billionaires, our fact-based reporting hands the mic to voiceless Texans. We are embedded in a framework of so many false narratives, especially as we discuss this Pride Month, what it means to be a queer Texan, with more episodes to come, by the way. So between targeted attacks on marginalized communities, whether you're queer or a person of color or poor or disabled or a person who could only attend public school or only access media without paywalls like NPR or Progress Texas, our battles are interconnected, and there's so much money trying to divide us. You can point to the few people monopolizing our media and trying to buy off corrupt politicians, and it's certainly paid off. That's why it matters so much more that as a community, we dedicate the resources we have. And that can be literal dollars. It can also be volunteering time at a community center. It can be packing reproductive healthcare kits, to signing petitions, to protecting our queer peers from harassment. Money and all the other resources at your disposal in the name of progress. So I'm super glad that we could have you here today, Robert. Thank you for all of your expertise and thoughts on these matters. And of course, this is Robert Robert Salcido, Chief Community Impact Officer at the Texas Pride Community Foundation. Progress Texas is an independent, nonprofit, rapid response media organization amplifying progressive values, leaders, and actions. While campaigns come and go, we are the permanent home for progressive media and action in the Lone Star State. Please support our peerless work. Thanks for listening and share this episode with a friend.